morning.
We're heading to our next episode. Buenos dias.
Hello world! We are in the third pilot episode of Power Talk with Prodigy, the Titanium Talk series. Today, we will be interviewing one of the most powerful and most inspirational women in Asia, I can say. She's the first woman doctor who arrived in the United Arab Emirates. And we want to know more about her story to inspire and empower you, right? Beth?
Exactly, Bess. Good morning, world. Good morning, everyone. And good morning to our VIP guests. So without further ado, we are now going to introduce to you Dr. Zulekha Daud. Hello, doctor.
Hi,
How are you, doc?
I am good and I'm glad that you have come to take my interview.
Yes, doctor. It is actually our privilege. We are very proud to have you in this third episode. And thank you so much for allowing us to come and meet you face to face and have this interview.
Yes.
So what's the first question, Bess?
We would like to give thanks first to Dr. Zulekha because whenever we invite her in our events in Prodigy Global Network, especially with the last event that we had. She's one of the top 50 global inspirational women to look out for in
Exactly.
2022 and beyond.
And that
By
was
Titanium
December
magazine.
8th, right?
Yes.
December 8th, last year.
So, Dr. Zulekha doesn't go out that much because of our situation right now, because of COVID. But then, she never says no for Prodigy. And thank you
Exactly.
so much, Doc.
Thank you
We
very
want
much.
to know the story. When did you come first in United Arab Emirates?
I came in August 1963. They sent me from Kuwait as a help worker for the women, you see. There were no women doctors here. And they had, but not very qualified ones. So there was no airport. I came from Kuwait. Kuwait Ministry of Health sent me here in 1963 August. And at that time there was no airport, seaport, and only there was Air Force, British working in here as a Tushel state service.
So how did you come, doc, if there is still no airport? You came by a helicopter from Kuwait?
There was no helicopter then, but there was a cargo plane which used to run. And I came in a cargo plane alone, and we landed in Sharjah because British it was there.
How old were you then, doc?
I was about 25, 26.
Wow, so young. A young doctor who came from Kuwait
India, Kuwait.
yeah,
then
from
UAE.
India to Kuwait, and then from Kuwait.
They sent me
To UAE.
to Dubai. I did not know what was Dubai.
True.
So I landed in plane I landed in Sharjah. There was a British Air Force, and then we came, and they took me to Dubai, all in the sand. We used to travel in Land Rovers.
Okay, Doc. So you came in Dubai in two shell state. That's the previous name of United Arab Emirates.
Before,
In a cargo plane.
yes.
And then you were invited, you were brought to Dubai
There
to,
was a temporary hospital there.
what's the name of that hospital, doctor?
That is Kuwait Hospital.
Kuwait Hospital. Also from Ministry of Kuwait, they brought you to the Kuwait hospital here in UAE.
Yes.
In the
To work in Kuwait Hospital.
Ah, great.
I was brought from there as an aide to work in crucial state, Dubai.
Yeah, it's only, sorry to cut you, doctor, but this is my first time I heard about the old name of the country. Like it's the two shell states.
True shell, true shells.
True shell states. And then 50 years, after 50 years, they name it where? For, what is it?
Before 50 years.
Before 50 years, they name it UAE, like United Arab Emirates.
And in 1971, they got their Ittihad.
Etihad.
Yes. They joined, all 7 states joined to form one United Arab Emirates, and Sheikh Zayed was the president.
That was 1971, and you came here in the country in 1963. Wow.
So you were the first woman doctor in UAE.
Sort of. I was to help the people of crucial state because in medical field.
Okay. So how did these women before give birth? Who are helping? Them?
They used to. The midwives were there.
All right.
There were missionaries midwife, and but it was in a very primitive form. People used to deliver in their house, and it was the best they could have.
So if there are complications during home delivery, that's the only time they will come to the hospital, right, Doc?
Yes.
Okay, but
They would come to hospital for normal deliveries also.
but most of them deliver in their home.
We had no equipments, no X-ray, nothing.
But then you deliver your first baby here in United Arab Emirates, right?
I was in Kuwait. I had to deliver, so I could not get any person to look after my child.
Okay.
So I had to go to India.
So you went back to India.
Somebody has to look after the baby, no?
Yes.
I can't work and do both.
Yes. And your husband by then
Was in Kuwait. He was completing his services. He was an ophthalmologist.
ophthalmologist, and by then you're an OB/GYN. Wow. But Dr. Sanubia, your daughter, was born here in UAE or also in India?
No, she was born in UAE, but I took her to India.
Ah, great.
Because you have 2 kids, Doc, right? Adil and Zenobia. She's the manager
She's in-
of
yeah.
Zulekha Hospital.
She's into management, and the son is in research.
The interesting thing is about Adil. So where is your son Adil now?
Adil is in California. He is working as a research of immunity, skin cancer, melanoma. He is the director professor in UCSF, University of California and San Francisco. So he has been working there for more than 15 years now.
So are you a citizen now?
Yeah, he's there. He has his wife is a specialist in breast cancer. So both are working there and they have 3 children.
3 children. And how you have 5 grandchildren, right?
So
Doc?
2 are Zanubias.
2 and 3 for adult. Doc, you were one of the top 50 global inspirational women to look out for in 2022 of Titanium magazine. So what we will be expecting from Dr. Zulekha this year and beyond?
See, I would like to continue my contacts with my patients, and I would like to know what my healthcare work is going on. I take part in it. I want to know everything, and it's going on well. The ministry is helping us a lot, and we are cooperating with the ministry because they are right to tell us what to do and what not to do. We have achieved the greatest excellence in medicine in Dubai for 10 years.
Great.
Innovation in healthcare.
Yes.
Yes, and like doctor, how long is Zulekha Hospital operational now? When did you found Zulekha?
You see, I was a practitioner. I had a clinic when I started in 64, 65, 66, because people used to come to me there, and I saw between 50 to 100 patients every day. Because you see, I was only one, and I tried to help people, tried to do what they wanted, and it could get on. When I came, there were no equipments, nothing, no help. We did it without it, and we kept on growing. No medicine, still we did it.
Herbal medicines there. Only the herbal medicine was there before.
Like what the people, I wanted to help people. Accidents, fractures, burns, poison, whatever, I could save the life.
That is really serving with the heart, Dr. Zulekha.
Deliveries, you see.
Yes. So I can't imagine how many deliveries you did from 19 or the moment you became a doctor. Because I'm a nurse midwife. I did delivered some normal deliveries, but not as much as you, of course. Now, with the notes, with the message that you shared today, when we entered your hospital, I actually saw a quotation from you, which it says, beyond the technology, beside the specialists, there is something more. And what is that something more, Dr. Zulekha?
The magic of touch.
Yes.
So let me just repeat the message that I resonate with, and I really do value this quotation, which I believe it is worth sharing to the world. Dr. Zulekha said that beyond the technology, beside the specialists, there is something more, and that is the magic of caring touch.
Care and touch of these specialists.
Understanding the patient.
Understanding the patient, because Dr. Zulekha is very hands-on with her patients. Even at her age at the moment, she's still hands-on with the operations. She actually knows what is happening in every corner of Zulekha Hospital. They have 2 branches, one in Sharjah and one in Dubai. But yet, she is very, very on it. Right, doctor?
Thank you very much.
Yes, and doctor, another question from me is, since you're an OB/GYN, and I believe that this month, January, is the Cervical Cancer Awareness Month, what would be your message to all women out there with regards to cervical health?
I believe and I think we have done a lot in preventing cervical cancer because we know the cause of it, and it can be done. You see, it is not that we cannot prevent it. So if you start from the very beginning, as the cancer says, it is just simple one test. You see of the cervical, and we can manage it very well. It is preventable and you can treat it, and people won't die of cervical cancer at all.
It's curable, right?
It's curable.
So
Yeah.
what can you say, or what you can advise to aspiring doctors out there if they want to pursue a medicine field or whatever? So what you can advise to them from your side?
Please take care of the people as you would take care of yourself. You know, the things which are preventable, don't tell them the truth, what they are suffering, and be very gentle and talk to them nicely. Everyone wants to write a prescription of investigation and all. It is also necessary to talk to them as human beings.
That's a very good message and powerful one to all aspiring doctors out there. If you want to be a doctor, if I get it right, Dr. Zulekha, if you want to be a very good doctor, do not be there to write prescriptions, do not be there to give instructions, but you should be there to educate your patients and give that care from your heart. That do not scare the patients, do not scare the people.
What the patient wants.
Yes.
What the patient wants.
Wow.
Ask them what they want, and don't teach them what to do.
No, just don't give them, okay, this is this, and little bit of human care.
Human care, yeah. There should be a human touch, and that is why we need to go back to her quotation wherein there is something more in caring, and that is the magic of
It's really true.
care.
It's
Yeah.
really true. Yes.
Human
Because
touch.
if you are sick, if a person is sick, he will feel better if there's a good care that is received,
Exactly.
right?
If you want to know what she is feeling.
Yeah, and going back, doctor, for this month of January, cervical cancer awareness month, I would like to know what the Zulekha Hospital is doing to create awareness about this.
We are trying to do free treatment to get the smear tested, cervical smear, and there are injections for the young girls and boys. So we are trying to give them free treatment to tell them what is cervical cancer. Wow. We give awareness programs.
So you heard that from the chairperson of Zulekha Hospital. Since this month is the cervical awareness campaign, you can come to their hospital and ask about the free screening of cervical cancer, and they will assist you. And that is actually one good community service, Dr. Zulekha, providing free screening for people, especially women who are very, very
inhibited.
Yes.
The people do not want to come out and get themselves tested.
Yeah, so yeah, it's a wake-up call for all women out there. Please.
Don't be afraid.
That's it.
Don't be afraid.
Don't be afraid. Come and be tested.
This is a new era. Women have to come out and see for themselves what they can do.
Yes.
Thank you so much.
And
Dr.
one
Zulekha.
last question, Dr. Zulekha. What is the future of Zulekha Hospital?
This you will discuss with my daughter. She's taking it to, yes, she's taking it to,
she's doing everything.
she's taking it to the further,
Next
level.
Oh,
All right,
wow.
Dr. Miss Zenobia, the daughter of Dr. Zulekha, is also one of the speakers of Prodigy Global Network in our Global Women Empowerment Summit.
Yes.
And we would like to thank Dr. Zulekha here for welcoming Prodigy Global Network, the Power Talk with Prodigy in her hospital. Thank you for all the support, Zulekha Hospital. Please get tested. Come to Zulekha Hospital, and they are giving you free tests
For cervical cancer.
for cervical cancer.
And we are doing that for the breast cancer also.
Also for the yes, we are.
Yes.
We've been following Zulekha Hospital's events during October for your Pink It Now. Right?
Yes.
It's very famous Pink It Now by Zulekha Hospital.
Yes. So once again, ladies and gentlemen, in the world, we would like to invite you to come and visit Zulekha Hospital as well. And of course, always remember the words of Dr. Zulekha. Beyond the technology, beside the specialists, there is something more. And that is the magic of a caring touch.
Yes.
By Dr. Zulekha. Thank you so much,
Thank
Dr.
you so much,
Zulekha.
Dr. Zulekha.
God bless everyone.
God bless
Stay
everyone. Stay safe and stay tuned for our last pilot episode
For the
with
month.
Her Highness Sheikh Jawahar bin Khalifa Al Khalifa.
And that's for to end the month of January. Thank you.
you.